DC, Zoonosis, interest group, Myzonic. Can I just kindly remind all participants to register your attendance using Google link that we will share shortly in the chat box? And can I also remind all participants to stay mute throughout the session? For any question, please use the chat box. The Q&A session will be held after both speakers finish their presentation. Please also provide your email with the question, as if we don't have enough time, the speaker will answer your question through your email. So we are grateful this afternoon to have two speakers that will talk to us about brucellosis. As for information, brucellosis is also known as indolent fever, Mediterranean fever, or also Malta fever. It is a zoonosis by a bacteria known as Brucella species, which mainly infect animals such as cattle, swine, goats, sheep, and dogs. The infection to human is most commonly transmitted by direct or indirect contact with the animal, the infected animals or their products. In human, it can hard to identify, especially in the early stage, as it presented with flu-like symptoms such as fever, weakness, malaise, and weight loss. It is said Brucella is a rare disease. It is often unrecognized and frequently goes unreported. Yet in Malaysia, we already have 2 outbreak episodes. One in year 2018 in Selangor, and another recently 2022 in Penang. So let's hear more from the expert. We have here with us Prof. Dr. Siti Khairani Bejo from Department of Pathology and Veterinary Microbiology, Faculty of Veterinary Medicine, University UPM Sudan. I believe your main interest more in lepto. Is it right, Prof? But she has participated in study about ovine brucellosis as early as in year 2006.
Yes.
Prof will share with us her expertise on One Health approach in investigation of brucellosis in animal. So without further ado, the floor is yours.
Okay. I share first. I share my this one. Everyone can get my okay? Is it okay?
Yes, please proceed, Prof.
Everyone can see my presentation?
Not yet.
Not yet? Right. I already share. Wait, okay, wait. It should be here. Wait, technical error. It's already here. Come. Wait. How they? Wow, they asked me to accept cookies and many things. Kejap ya. Kenapa ni?
Tak apa, Prof.
Normally is okay, wait. Share screen. It's not here.
Prof, have you shared your slide with the...
I already shared my
co-host?
slide with Rizwan.
Okay, hold on. We try from our end, Dr. and Prof.
But how come I can't share this? Because they asked, okay, it is okay, this is okay, this is from Rizwan.
This is from Puan Hartini. Puan Hartini will share the slide on your behalf. Is it okay?
Okay, can. Okay.
Thank you,
Okay,
Prof.
sorry, I don't know why. Okay, Assalamualaikum warahmatullahi wabarakatuh and good afternoon everyone. I can see it is about 85 participants today. Alhamdulillah. Okay, thank you Dr. Mimi and Dr. Rizwan who invite me I mean who meminang yeah for the first attempt. He asked me what to say to give some talk, small talk in brucellosis. Okay, so this is the topic of this discussion. Yeah, actually, I'm not expert. I just share with you what we have here in UPM. Yeah, okay. So One Health approach in investigation of brucellosis in animals. I joined One Health Malaysian One Health University Network since 2012. Yeah. So that's why I choose this topic. Yeah, One Health. Okay. Next, please. Okay. So okay, so this one, how I can I can see full. Okay, wait. Okay. Okay. So I think most of our participant is familiar with brucellosis. Brucellosis, this disease, this is highly infectious zoonotic. Everyone know what is zoonotic disease, yeah? Okay, because I'm not sure the background of our participant today, but I hope most of us involved in this zoonotic disease, yeah? Okay, and this disease or brucellosis is caused by Brucella species. Yeah, Brucella species. Generally, it caused by Brucella species, but in animals, brucellosis caused with many species of Brucella is depend to the species of animals. Yeah. So, brucellosis is one of the most prevalent zoonosis worldwide. Yeah. And one World Organization for Animal Health, or OIE, they prioritize this disease, yeah, because this disease impact public health, economic, and global trade. That means they are like, it is very important. Every single sector involved in this disease. Next, please. Okay. So, as published, I mean, this is from literature. There are currently 13 species of Brucella. Yes, this is species of Brucella with a range of hosts. I mean, different type of hosts. Okay, and we have like for dogs. Yeah, this is that why I mentioned before. This is a great one relevant includes, which is many species of animals involved and human, because they are zoonotic, then human also involved with this disease, brucellosis. We have dogs. Yeah, dogs normally infected by Brucella canis, and for swine or pig is infected by Brucella suis. For a cattle can be infected by Brucella abortus and Brucella melitensis, yeah, because from our study, we found that our cattle give positive RBPT to Brucella to Brucella melitensis too. That means they are not only specific to Brucella abortus. And Brucella melitensis, they affect sheep and goat and also cattle. And this Brucella melitensis is very important because especially they cause serious disease in human. Yeah, okay, especially in international traveler. And due to zoonotic nature of brucellosis, so we need to, I mean, we require awareness, especially for medical professional, both in human and animals. Yeah. So because this brucellosis, yeah, is one of the good example for One Health, yeah, for One Health what to say, approach, yeah, because it's involve human and animals in one time. Okay. So, but the problem is we facing with diagnostic limitation, yeah, and for treatment practice, especially in animals, yeah, in animals, yeah, and also preventive and preventive surveillance program. In animals, I mean in livestock especially, we have programs. We have a program, eradication program, which we sample the animals every 6 months. Yeah, that means twice per year. Okay, please next. Okay, so this is just a list of Brucella species by host. Yeah, because as I mentioned just now, Brucellosis or Brucella species, they have a special or they have a specific host. Yeah. Okay, so we have like for example, like we have Brucella mitensis, Brucella abortus, Brucella suis, Brucella canis, and Brucella ovis. This is I list down. I mean the list according to the priority. That means which species is commonly affect animals, yeah, in Malaysia especially, because we don't have like Australian rats is not present in Malaysia, isn't it? So starting from Melitensis, Abortus, Swiss, Canis, and Ovis. This is present or detected in Malaysia. Please, next. Sorry. Okay, so as I mentioned just now, brucellosis is a good example for One Health. Yeah, One Health, because they can cause, I mean, for human, they can get infection from many, I mean, from various type of animals. Yeah, that mean we are like end host, yeah, for human, because human some report mention that human can transmit the organism, but it is not really what to say, not to say proof, but there are not many report about this. But as we know, I mean, many literature mention that human is a dead end of this disease. Yeah. Okay, so we can see here, human surrounded by animals, and we just wait for the infection to come to us. Okay, so we have to take care about this disease. You can get infection from cattle. You can get infection from pig. We can get infection from goat and sheep, and also from rodent. Yeah, and if you have a pet, we have a Brucella canis, which infect dogs. Okay, thank you. Next, please. Okay, so this is very basic. Very basic for common feature of Brucella species. I hope everyone familiar with this bacteria, because this Brucella, they are gram-negative, they are facultative, intracellular rod, and it is not cocci, but this is from one of the review. They mentioned that they are cocci, but actually they are Coccobacillus. They are not cocci. Yeah, they are not cocci, but they are Coccobacillus. Yeah, okay, and they happily stay in cold and wet condition, and also in tropical country. Okay, so but this organism, even though they are, yes, if you contact with fresh sample or fresh materials which is contain this bacteria, you might get infection. But this bacteria can easily killed by pasteurization, yeah, and disinfectant. Okay, so if we keep what to say, I mean, in terms of PPE, if we're ready with, if you handling a case of or suspected case of brucellosis, you have to make sure that you covered or you ready with complete PPE. Okay, and this brucella, we divide them into two group or into two what to say, into two groups, which is one is smooth colony phenotype. They have two phenotyping, which is one is smooth colony, and other one is rough colony. Okay, so for a smooth colony, we have Brucella abortus, Brucella melitensis, and Brucella suis. While for rough colony, we have Brucella canis and Brucella ovis. Okay, next please. Okay, so okay, this is illustration. Yeah, this is from very nice illustration where we can see that primary modes of human and animal brucellosis transmission. That means how human can get infection. Yeah, so the transmission can be directly through ingestion. Yeah, for example, like we drinks raw or unpasteurized milk or dairy product, or is you can get infection through mucous membrane or from abraded skin, yeah, skin cut, skin cut, okay, and you might get from inhalation. Okay, for example, you can see here for laboratory and occasional exposure, this is happen in the lab. Okay, and raw milk, okay, that one is very common. For raw milk, it's very common. There are many what to say, reported case, human get infection by consuming unpasteurized dairy product. Okay, and for people who work in the farm, we might get infection from a cattle, for example, during abortion. When this cattle abort, then you handle the case, then you might get infection because it's direct contact. Yeah, and during vaccination, okay, for people who work on vaccine, make sure that you what to say, you not handle the vaccine. Yeah, okay. So next, please. Okay, this is a pathophysiology of Brucella species. That means even though we have Brucella abortus, Brucella melitensis, Brucella ovis, but they are like they are not what to say. They can be present. They can be present in the, for example, like in the mucous membrane, in the lymph node, yeah, especially lymph node, yeah, for they localize in the lymph node, and these bacteria or Brucella, they can be present or proliferate within macrophages. Okay, so they can spread hematogenously. These bacteria can be spread through the tissue. Yeah, through the tissue. For example, like during gestation or during pregnancy. Yeah, pregnancy normally in human, but for animal we mention gestation. Okay, so these bacteria can be present in uterus and placenta. So that's why I mentioned just now, brucellosis is one of the good example of One Health approach. Yeah, I mean good example because from animals, human can get infection when they handle contaminated material, or when we handle, for example, like uterus, placenta from aborted or aborted fetus. Yeah, okay. So this is the why this leptospirosis, brucellosis is important. Yeah, okay. Next, please. Okay, so these brucella, when they enter the body, okay, they enter the body, Then they go to the tissue, for example, like they go to reticuloendothelial system, okay, and the spleen, in the lymph node, okay. They also move to mammary gland and reproductive tract, okay. So when they localize here in this particular organ, yeah, in this particular organ, they might reside there for a longer time. Okay, they stay there, and in a certain condition, they might multiply and cause a disease, especially if the animal pregnant. Yeah, okay. If they start pregnant, so the what to say, the erythritol, which is present during pregnancy. So this will stimulate the growth of Brucella species. Yeah, but they in the normal condition, they just reside inside a gland. Yeah, okay. So and this after some time, they also can move to eye, to kidney, to meninges, and vertebral dish. So for example, like in dogs, yeah, they can cause problem in the joint. Yeah, okay. So this is that means they cover all over the body. Okay. So the intracellular presence of brucellosis, yeah, then they can be after the animal get infection, and these bacteria start to localize, then the body start to develop antibody. Yeah, that means the host immune system. Okay, so this is why treatment, yeah, it is not easy to treat brucellosis. Yeah, okay, continue please. Okay, so for clinical manifestation of brucellosis in animal, okay, in animals, the clinical manifestation of brucellosis is abortion. This is the main clinical manifestation of brucellosis. It is abortion. Okay, and other characteristic or other characteristic clinical signs, especially in female, you can get birth or stillborn or weak offspring. Yeah, they are very weak, or retained placenta, decreased male yield, and decreased infertility. And for males, yeah, they might cause otitis, epididymitis, that mean all these are reproductive organ. Yeah, okay. Next, please. Okay. For clinical manifestation of brucellosis in animal, and this is continue, yeah. Okay, so this bacteria or Brucella species, they can be present in the vaginal discharge, yeah, and also in the milk, yeah, because vaginal discharge, because they localize in the reproductive tract, then they might release in the vaginal discharge, and if they go to mammary gland, they will be released in the milk and urine, semen. This is what to say, the material which is commonly we choose for diagnosis, yeah, especially for detection and also for isolation of the bacteria, to isolate Brucella. Okay, so Brucella, this Brucella species, they can be, as just now, yeah, they're present in the milk because and vaginal discharge, and these even though they're present in this organ, but sometimes the what to say, the calf, they born like a normal birth, normal birth, normal parturition, asymptomatic, yeah. So for us as a vet, sometimes we misdiagnose. We thought that they are healthy, so we simply touch them and do what to say a common or a common practice, yeah, when we handle calf, yeah. But this is the stage where human might get infection, yeah. So that means after abortion, especially in a big farm, yeah, in the big farm, the animal, they are free grazing, they're free grazing. So the owner or the animal handler, sometimes they are not noticed that the animals having abortion, yeah? They not notice they having abortion. So they just what to say they not do any what to say the caution, or not they not they not notice that this cattle or goat or sheep, they are having abortion. So this is one of the problem where human can easily get infection from this or asymptomatic carrier or asymptomatic having abortion, yeah. Okay, next please. So in some condition, yeah, this is in animals, you can see abscess, yeah. You might especially in the membrane when you, I mean during this, okay. So so this is if abscess, I mean in the case of abscess is the animals already develop abscess. So this abscess is very dangerous. Why I say that? Because they become a source of infection, yeah. They become a source of infection, and at the end the problem is in reproductive failure, yeah. The reproductive failure, okay. In animal cases, the diagnosis of brucellosis is complicated, yeah, because if they show clinical signs, okay, but if they not show any clinical signs, it is difficult for us to diagnose, yeah, okay. So but you can observe the animals if they are anorexic or weight loss. But in a big farm, sometimes we miss, yeah, we miss these clinical signs, we not observe them. Okay, thank you. So next. So for diagnosis of brucellosis, a bacterial culture is a gold standard, yeah, it's gold standard for diagnosis. That means we isolate the bacteria, yeah, from the sample. That means we confirm that, okay, we suspect the animal infected by brucella, and we get the isolate from the sample. So that's why we say that bacterial culture is gold standard, yeah. Okay, but to isolate them is not easy. They have a special procedure to isolate the bacteria, and we need what to say bio safety cabinet, yeah, to handle the sample, okay. So the sample that normally we collect from suspected case of brucellosis, we collect aborted fetus, okay, placenta, then we might collect lungs, yeah, and stomach content from the fetus, okay. So for antemortem culture specimen, you can collect blood, urine, semen, and vaginal discharge. Okay, and for postmortem, okay, for postmortem, you can collect lymph nodes, yeah, because we know that the bacteria or this leptospira, they localize in the lymph node, so you can collect lymph node, yeah. For example, like iliac lymph node, mammary lymph node, and perifemoral lymph node. Okay, that means all these are very close to reproductive organ. Yeah. Okay. Next, please. Okay. So, negative culture never rule out Brucella species infection due to following. One is intermittent bacteremia and shedding. Okay. Organism viability, especially if associated with antimicrobial drug administration and potential of blood culture contamination. For this Brucella, they are not as easy as E. coli to isolate them. They need a special media, yeah, and they need a special condition to grow in the lab. Okay, and they are slow growing bacteria or slow growing bacteria in the lab. They might need about 3 weeks, yeah, to grow. That means before 3 weeks, don't throw the your plate, yeah, your inoculated plate. Okay. So next, please. Okay. So other than isolation of the bacteria, then now we have PCR, polymerase chain reaction. Okay. For PCR, it's good. They can give you a very rapid result. Yeah. Okay. But here, for PCR, what we only have a species specific. That mean no, not species. They up to genus specific. That mean they just tell you the sample positive to Brucella, but they not give you specific species what species of Brucella from the sample, yeah. But they give you rapid result. For eradication program or for treatment, yeah, especially for human, yeah. Okay. PCR is very it's good because they can give you a very rapid result. So PCR, if you plan to treat, this is in human lah, to treat to start with treatment, it is good if you do PCR. Yeah. So PCR, you can collect whole blood, that means from blood, from vaginal secretion, urine, semen, tissue, same as for culture. Because for culture, the bacteria present in this sample and you isolate them from the sample. But for PCR, we just work on their DNA. That means in PCR, even though you collect the sample, you might keep the sample, for example, like after sampling, you keep them outside, outside for a few hours, it should be okay. But for culture, you need to make sure that the bacteria is still alive when you inoculate them into agar, yeah. Okay. So next, please. Okay. Okay, for diagnosis of brucellosis, we also can do serology. Okay, serological assay. There are this is especially for screening, yeah, for brucellosis. We do serological assay for screening. Okay, so this cell, they have for gram-negative bacteria, they have outer cell membrane. Yeah, it is for all gram-negative bacteria, and it is not specific, especially IgM, not specific. So they might cross react to other bacteria. So they might give you false positive result. Okay. But we have this, yeah, Rosbanger plate test. This is very we use Rosbanger plate test for screening, yeah, for screening to identify infected farm. And after that, we continue with CFT as a complementary test. If the animal positive to both RBBT and CFT, then we confirm that these animals positive to brucellosis. Okay, next please. Okay, this is the diagnostic test issue. That means there are many tests. I mean serological tests. Okay, there are many tests, or there are many method to diagnose brucellosis, but they have some, what to say. This here is from the literature where they say common mistake. Yeah, for me it is not common mistake, but it is like complicated lah. That means you need to you really need to know, especially the history of the case. Yeah, the history of the case. That means if we submit sample to the lab, you have to mention, or you have to write a good history. Yeah, so from there, the person who work with your sample will choose which diagnostic test is suitable for your sample to detect brucella. Yeah. For example, like you have in vitro smooth brucella readily generate rough mutant. This is, they say that for buffer agglutination, we have test, for example, complement fixation test. They might the result might not consistent. Yeah. Okay. For ELISA, sometimes you have incorrect seroprevalence. Okay. This is especially to state the cut-off value. That means in which stage they are positive, the cut-off value, after which, for example, like the optical density, what optical density and what is the filters, apa kata, the filter for the reader. So this is like you have to make sure that this, you follow the instruction, and from the, especially if you buy a kit, ELISA kit. Okay. So this is the why diagnosis test, serological test sometimes not give you the result. For example, like misleading understanding, like incorrect seroprevalence estimated. This is in RBPT, because for this serology, they're not able to differentiate between current infection or natural infection and vaccination until you have a good history from the owner, from the submitter. If they mention that, okay, the animal vaccinated with what vaccine, then it should be okay lah. Yeah. Okay. Okay, next please. So this is, I just mentioned little bit, we discussed a little bit on Brucella species, which is the most important Brucella species is Brucella melitensis, because they cause serious problem in human, and this Brucella melitensis is endemic in Asia, our country, in Middle East, South Africa, and America and Africa. So these melitensis, they responsible to human brucellosis case. Human brucellosis case. High case of brucellosis due to Brucella melitensis. Okay, and this melitensis, Brucella melitensis, they have a smooth colony phenotype, and the most pathogenic one is the Biova 3. Okay. Sheep and goat is a reservoir host for this bacteria, for this species Brucella melitensis. That means they can maintain this bacteria in their body. That means they maintain this bacteria in their for example, like in their reproductive organ, in their lymph node. Okay, so they might release this bacteria in the urine or in the semen. Okay, and they not show any clinical signs because they are hosts. Normally they not show any clinical sign until they, what to say, for example, like if they pregnant, they might the abortion in the late stage of pregnancy, then only that you will collect the sample and test for brucellosis. Okay, so like in Malaysia, we have eradication program, which is we have test and slaughter. That means if the animal tested positive to Brucella melitensis, we have to slaughter. That means we have to cull the animals. Yeah. Okay. So this is based on RBPT and confirmed with complement fixation test. Yeah. Okay. Next, please. For Brucella abortus, this is they are primary cause brucellosis in cattle. Okay, and for Brucella abortus by one, this is considered most significant cause. This significant livestock disease, and they also can cause disease in human. Yeah, if human contact with not infected animal lah. That means they contacted with infected materials from the animals. Yeah, okay. Or they consume unpasteurized dairy product. Yeah, okay. So ingestion is one of the common route of infection in cattle. Okay, and environmental contamination. This is especially during if the animal grazing in the in the open field, then as I mentioned just now, if the farm is big, then the handler also not realize that their animals, cattle got abortion somewhere, kat mana dalam jauh-jauh sana kan. Then other animals come and eat the aborted material, they might get infection. Okay, so the grazing contaminated area, this is cycle. That means the animals, they not get infection directly contact with infected animals, that they might get infection when they eat or they digest grass which is contaminated with infected material. Okay. Next, please, again. So, Brucella canis, yeah. So, Brucella canis, by looking into their name, canis, that means this is Brucella, the primary host is dogs, okay, dogs. But they also can infect human, okay. And in Malaysia, however, the seroprevalence rates of brucellosis or Brucella canis infection in Malaysia is not available. It's not available. Okay, because in Malaysia we focus on livestock. That means cattle, buffalo, goat and sheep. That means our livestock, but we not do any program for dogs. Yeah. This is normally happen in stray dogs. Yeah, stray dog, they are uncontrolled breeding. Yeah, in the population. Okay, then this disease or this bacteria can be transmitted to other. From one dog to another. In the semen. Yeah, in the semen. Okay, so this is one of the problem. Okay, so this is what to say, this is can be happen in the kennel, in the shelter. Yeah, because sometimes it's like overcrowded. Yeah, okay, so I think so far they not do any routine what to say, routine tests for Brucella canis. Yeah, in the especially in the shelter. Yeah, so we don't know whether they are positive or what. Yeah. So because they not show any clinical sign, but the problem is if they transfer the bacteria to human who handle them. Okay. Okay. Next, please. So for Brucella canis, like veterinarian, yeah, kennel workers, dog breeders, they are at a very high risk, yeah. Okay. So the transmission, okay, from human normally is through contact, direct contact. Okay, to direct contact from the discharge. Okay, so urine also can be a source of infection. Feces, saliva, yeah. So we can easily get infection, yeah, infected. We can easily get infected by this particular bacteria. Okay, so human can get infection through direct contact with a contaminated material. Okay, next please. Okay, for laboratory diagnosis for Brucella canis, we have canine Brucella multiplex assay, okay, indirect fluorescent antibody test, tube agglutination test, rapid slide agglutination test, and agar gel immunodilution assay. But in our lab, we only practice tube agglutination test. Yeah, we have antigen for tube agglutination test, and we offer for service this one, yeah, for tube agglutination test to detect Brucella canis infection. Okay, next please. Brucella ovis, yeah, for Brucella ovis, okay, again, if we look into their name, ovis, that means this is in sheep, yeah. The reservoir or their host reservoir, this is the host is Brucella ovis, yeah. But here is special. They are not a zoonotic. That means if the animal infected or sheep infected by Brucella ovis, we can say don't worry lah, because they not get infection by this Brucella ovis, yeah. But transmission of this Brucella ovis is same as other, yeah. And there are no vaccine for Brucella ovis. That means there are no vaccine for sheep against Brucella ovis. For diagnosis, you can as other Brucella species, you can collect samples. Okay, you can collect, for example, like sama lah, same lah, male or vaginal swab and all that. And also you can test the sample using ELISA, yeah, including ELISA. Okay, next please. Okay, this is, I touched a little bit on One Health, the topic, yeah, the topic is on One Health. One Health is an approach characterized by integration of human and animal health. Plant, ecosystem, encourage joining local, national, and global multidisciplinary effort to achieve optimal level of health and collaboration among different disciplines to address complex health problem. But normally this One Health, we involve three main components, which is human, animal, and environment. But actually they cover more than that, yeah, more than that, because the aim is to make sure that we are live in a health condition, yeah, that means in the health environment. Okay, so next. Okay, so this is one of the case, yeah. I got case. This is case where One Health investigation of brucellosis, yeah. This is one case of investigation. Okay, this is example, eh. This example. Okay, this is case of one veterinarian. They handle aborted sheep, yeah, aborted sheep, and they have clinical symptom, but this veterinarian, they are not able to differentiate, or they are not able to to make a final diagnosis whether this is brucellosis or not, but they handle aborted material. Okay. Then after 15 days, after 15 days, after 15 days, they touch, or they handle the case. This is dystocia case and dead fetus. Okay, they remove the fetal membrane. They do all the cleaning, in the field. Then they facing a problem. They show a symptom. This veterinarian. Okay, so they collect sample from cattle, from cow and sheep, and they test with they test the sample RBPT, because this is serology. So they test the sample using RBPT, SAT, indirect ELISA. Okay, so the cow
Prof, can I remind you, you have another about 5 minutes?
5 minit Okay, tak apa. Okay, this is maybe can be last. Okay, so the serum were collected from both cow and sheep, and after they got the result. Okay, so they contact with all this, the material, that mean contaminated material. Then they found that this guy positive to Brucella, to RBPT, and also the serum, the serum negative but to PCR. But when they go back to the history, then they remember that, okay, he handled dystocia case. Okay, so that's why this is very important. When you handle any suspected case of brucellosis, you just do PPE. You protect yourself. Don't simply handle the case without take a caution. Okay, so I think this is what I want to share with you lah. The One Health investigation of brucellosis case. That means they are come from the source, and then you continue with diagnostic. That means if you want to do a diagnosis, that means you start from the history. That means from the animals, what happened in the farm. Then you bring the sample into the lab. Then you compile all this. Then at the end, you can get the whole story as confirmed case of brucellosis. Okay, I think that's all, Dr. Mimi.
Okay, thank you, Prof. Thank you for a very informative presentation. We have a few people want to ask a question, but we shall wait until another speakers finish their presentation. Okay, thank you, Prof. Can you stop your sharing?
No, I'm not sharing.
Okay, right. Okay, thank you. So we can go to the next speakers. Our second speaker is Dr. Roshalina binti Rosli. She is a pathologist, a medical microbiologist from Tengku Ampuan Rahimah Hospital, Kelang, Selangor. The area of interest is about microbacteriology. However, this afternoon she will share her expert knowledge on human brucellosis outbreak. Dr. Roshalina? Are you around?
Yeah. Assalamualaikum warahmatullahi
Okay, the floor is yours.
wabarakatuh. So I try to share my slide. Can you see my slide?
Yes, doctor, but yeah, it's not the
okay.
screen. Okay.
So okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And Good evening, everyone. Okay, I'm not an expert on this topic, human brucellosis outbreak, but I try my best to present on this human brucellosis outbreak. And okay, as we know that brucellosis is endemic in several regions of the world, such as the Eastern Mediterranean, the Middle East, Arabian Peninsula, Latin America, Southern Europe, Central Asia, the Indian subcontinent, and many African countries. And this brucellosis represents the most common zoonotic infection with about 500,000 new human cases per year. And the genus Brucellosis groups a total of 12. Actually, just now Dr. Prof mentioned 13. So actually, so from the 13 species, 6 classic species, Brucella melitensis, Brucella abatus, Brucella suis, Brucella canis, Brucella ovis, and Brucella neutami, and 2 species from marine mammals, Brucella seti and Pinnipedalis. And there are 3 new species, Brucella mycoti, inopinata, and recently described as Brucella papionis. Okay, and then there are 3 Brucella species that are highly virulent to their natural host as well as human, which are abatus, which primarily infect cattle, militensis, infect sheep and goats, Swiss, which infect mainly swine, and the most pathogenic for humans is Brucella militensis. And brucellosis, also known as undulant fever, Mediterranean fever, or Malta fever, and is transmitted to humans from infected animals by ingestion of food products such as unpasteurized dairy product or raw milk, or by contact with tissue or fluids. And it affects people of all age groups and both genders. And most commonly, human acquire brucella through consumption of unpasteurized dairy product, raw milk, butter, soft cheese, or ice cream made from raw milk from infected animals. Okay, this is global incidence of human brucellosis. As we can see here, this is a heat maps of regional annual incidence of human brucellosis estimated per 1 million population at risk. And the heat maps actually intended to represent transnational zones that require priority control, not to represent the risk of individual countries. And as we can see, the color of the heat scale, yellow to blue, yellow means high risk to low risk is blue. And A is represent Africa. The average risk is about 750 new cases per million. And B is Asia. The average risk is about 500 new cases. And C is America. Average risk is about 20 new cases. And D is Europe. The average risk is very low. It's just 10 new cases per million. And how about Malaysia? We have our first reported cases following isolation of Brucella abatus in 1950 and Brucella suis in 1963. And subsequently, our cases human brucellosis search, then the area-wise eradication of bovine brucellosis was initiated, and which was implemented nationwide in 1979. And with this effort, had reduced the prevalence of bovine brucellosis in Malaysia from 3.3% to 0.23% from 1979 to 1988. And actually, the true incidence and prevalence of brucellosis in Malaysia are unknown because brucellosis is non-notifiable disease, and only at administrative level, means if there is an outbreak, the hospital will inform to the health PKD or health district. And the table here showed that Brucella cases admitted from year 2004 to 2008. I just get it from this guideline, human brucellosis in 2012. As you can see here, from year 2000 to 2008, we just have just low case of, Brucella case, only 1 case, and maximum, the highest number is it was in 2006. Okay, this is article published by IMR last year by Dr. Siti, Rosilawati and the team. This article or this study on 6 years retrospective study on seropositivity in Malaysia, and the study actually is a retrospective study on seropositivity trend of human brucellosis cases from 2014 to 2019, and the sample, a total of 1,281 serum sample was obtained from suspected brucellosis in Malaysia, and the serum were tested using ELISA to detect IgM and IgG antibodies for Brucella species. And if the result turn out to be equivocal or positive antibody index, they will confirm it with confirmed by Brucella cap or immunocapture agglutination. And from the finding of this study, about 5.8% of suspected cases showed about 74 or 5.8% of suspected cases showed seropositivity for human brucellosis, and central region has the highest seropositivity cases of brucellosis. Central region consists of KL, Selangor, and Putrajaya, and the risk factor due to consumption of unpasteurized milk, and the age group of less than 15 years old was more likely to get brucellosis. Okay, I'll go to the chart. This characteristic of the seropositive brucellosis. As we can see here, the factor, the race, Malay had the highest positive cases, about 71.6%, followed by Chinese and Indian. And for gender, actually an equal amount for male and female. And for the age group, 15 to 64 years old had higher positivity result, case, about 64.8, and the consumption of the unpasteurized milk about 27%. And if the workers working with livestock, only 4% from this study. Okay, as we can see, this is total cases from our Malaysia map. We can see total cases and percentage of seropositive human brucellosis from 2014 and 2019. Just now I mentioned central region contribute the highest seropositivity is about 39 with 8.6%, followed by southern region, Johor, Melaka, and 9, and followed by northern region, Kedah, Perlis, Perak, and East Coast about 3.8% from Kelantan, Terengganu, and Pahang. And from the graph, if we can see this chart, from 2014 to 2019. So like every year, for 2015, we can see surge of cases from southern region and central region. In 2015, if I'm not mistaken, there was an outbreak in southern region in Johor that time. And for the 2016, it's okay. And there was a surge of cases again, as we can see here, for 2017 and 18 from central region, because of surge of cases, most likely an indication of outbreak. And 2019, as we can see, is acceptable number. It's same like 2016. Okay, this is about this study on the retrospective study on seropositivity in Malaysia. Okay, the mode of transmission of the brucellosis, ingestion of consumption of unpasteurized milk or dairy products, and direct contact with infected animals like veterinary, just now Prof mentioned. High risk occupational exposure include farmers, stockmen, veterinarian, meat inspectors, abattoir workers, and who work involved with this processing of animal products. Prevalence brucellosis also can be caused by Brucellosis or canis, because certain travelers might have contact with infected animal, such as Brucellosis in feral swine or reindeers, and Brucella canis in dogs. And then other than that, inhalation of aerosol generated by any activity during handling of Brucella isolate in the lab also can be a mode of transmission. And consumption of undercooked meat from infected animal can lead to infection, but the exposure is less likely because the bacterial load are lower in muscle, and person-to-person transmission is very rare. Okay, for the fetal physiology, the incubation period is highly variable, usually from 5 to 60 days. 1 to 2 months is common, and can be up to 5 months. And when ingested, the Brucella phagocytose, because it is intracellular bacteria, so it are phagocytose and enter the intestinal submucosa, then transported to lymphoid tissue by macrophage. In the bloodstream, it will contain in the neutrophil in the form polymorphonuclear cells and macrophage. And this bacteria do not activate the alternative complement system, and will be transported or will be disseminated into the lymphatic system and may replicate in liver, spleen, kidney, breast tissue, or joints, causing localized and systemic infection. Okay, for the clinical manifestation, actually it's non-specific, but from the acute or insidious onset can be characterized by intermittent fever, prolonged fever with headache, profuse sweating, weakness, generalized aching, and arthralgia. And the acute disease may last from days to weeks, but chronic infection lasting for months or more. And if an acute infection is not adequately treated. And in chronic symptoms include patient may present with chronic fatigue syndrome, maybe fatigue, depression, generalized body ache or weight loss, and involvement of liver, spleen can cause abscess, and osteoarticular complication occur in 20 to 60% of cases, most commonly sacroiliitis, and genitourinary involvement occur about 2 to 20% of cases, particularly orchitis and epididymitis, and involvement of the lymphoreticular skeletal arthritis, osteomyelitis, endocarditis, and as well as neurobucellosis. In fact, the central nervous system. Okay, this is symptom and sign in 500 patients with brucellosis due to Brucella melitensis from WHO Brucellosis 2006. As we can see here, the most common symptoms were fever, were joint, lack of energy, aching, fever, joint and back pain, and sweat that contribute the most common symptoms. And this is a study published by Hausenite et al. By comparing pediatrics and adults. As we can see here, for the symptoms and sign, they're almost the same, except for the adult. They present with testicular pain about 11%. And from the presenting symptoms, almost the same. I mean, pediatric and adults present with fever, as also GI symptom, abdominal pain, vomiting, diarrhea, about 40 to 50% of cases. Neurological headache, dizziness, weakness, also 40 to 44%. Muscular pain, back or joint pain, about it's the same, 40 to 44%. And other constitutional symptoms. And for the duration of symptom, the median days for pediatrics was 10 days, and for adults, 16 days. And for the complication, adults and peds can get hepatosplenomegaly, osteomyelitis, orchitis, splenic lesion, neurobucellosis, and also can present with relapse. And this is main complication of 328 patients with brucellosis. The most common complication, the first one, lumbar disease, about 41.46. So they affect the joint, I mean lumbar disease, knee joint, followed by abnormal liver function and also spleen and lymph nodes enlargement. Okay, for the case definition of human brucellosis, um, based on guideline for the diagnosis, management, prevention of brucellosis in Malaysia. So brucellosis should be suspected in patients who have fever and history of consuming raw or unpasteurized milk or occupation associated with a high risk of infection with brucellosis. And for the clinical definition, an illness characterized by acute or insidious onset of fever and or more of the following symptoms: night sweat, fever, anorexia, headache, and the rest, with history of exposure to probable sources of infection. That is clinical definition. And for the probable case, a clinically compatible illness with presumptive lab evidence of Brucella infection by positive antibody, and with epidemiological link to a confirmed brucellosis case. And for the confirmed case, a clinically compatible illness with definitive lab evidence of brucella infection from either one of the following. We can get isolation of brucella from clinical sample, evidence of brucella antibody, and as well as positive by PCR, can be blood, CSF, or isolate. Okay, this is just a summary of the case definition just now. Okay, for the lab diagnosis, laboratory diagnosis of human brucellosis, the key diagnostic tests for brucellosis are the isolation of bacteria from the clinical specimen, surgical tests, and PCR. And Brucella is an infectious pathogen that requires the use of biological safety level BSL-3 or BSL-2 with BSL-3 precaution for manipulation of specimen and culture. And the clinician should alert the lab when a diagnosis of brucellosis is being considered so that the lab staff can take the necessary safety precaution, and on the lab form should be write as to rule out brucellosis in red ink. And okay, this is the taxonomy of Brucella species. Brucella are small. The size is about 0.5 to 0.7 by 0.6 to 1.5. It is non-motile, non-spore forming, and is slow growing gram-negative Coccobacilli. So gram-negative Coccobacilli, and it belongs to Brucellaceae family in the alpha-2 subclass of the proteobacteria, together with Macroplana, Pseudoprobacterium, Penobacterium, Dengue, Crabtrilla, and Ochrobacterium genera. So we must remember that because of this Ochrobacterium, member of Ochrobacterium genus are close related, close about sharing 95% identity with Brucella, a sequence of 16 RNA gene. So Ochrobacterium atrophy and Ochrobacterium intermedium related to Brucella, and the similarity may cause the implication for the correct identification, because of why several commercial systems might misidentify Brucella for closely related bacteria species, which is they will identify as Ochrobacterium. Okay, and then from the blood culture and clinicians and blood culture, for this Brucella is slow growing, and also because of it takes about long doubling time, about 2 to 4 to 3 to 3.5 hours compared to other human pathogen, and CO2 release also limited because of they are using this exclusive pentose phosphate pathway, and they try to simulate blood culture because the production of CO2 Brucella melaitensis was found to be slower than other bacteria, and it reached lower peak concentration by the automated blood culture system. And from this study 2019 by Hassana et al., they found that medium time to positivity for the blood culture for adults, I mean to get positive, flag positive for Brucella is about 85 hours, and which is longer than adult about 70 to 78 hours. So like day 3 of incubation, if Brucella from this study, Brucella can be detected after day 3 of incubation. Okay, for this presumptive identification of Brucella is based on the typical gram staining appearance. As we can see here, this is gram-negative coccobacilli. You can see very tiny morphology, and look coco and bacilli. And the other biochemical test, positive oxidase, catalase, urease activity, and no fermentation of sugar, and also non-motile. And the Brucella grow on black agar and chocolate agar, but fail to grow on MKAK. And we can see slow growing colony will grow after, I mean, on day 2 incubation. Okay, this is gram stain to differentiate Orcobacterium and Brucella militensis, because just now I mentioned that several commercial automated identification can misidentify Brucella as Orcobacterium. And for this gram stain, you can see from smear from colony, we can see it's gram negative coccobacilli, very tiny and fade. And then if gram stain from the blood culture, it can resist decoloration and we can appear as a gram positive, but we have to really look at the morphology. It's very tiny gram negative coccobacilli. It doesn't look like rod, I mean like Acinetobacter, what we call Acinetobacter gram stain. It's very tiny and coccobacilli. And for the Orcobacterium, the gram stain is pleomorphic and usually is bigger than this coccobacilli. It's a gram negative rod. It's bigger, and this is a gram for the gram stain Brucella. Usually it will clump together and is very a faint staining and tiny coccobacilli. Okay, this is growth on the black agar, chocolate agar, MKAK agar. To differentiate or spell between Orcobacterium and Brucella militensis. As we can see, this 24 hours after 24 hours incubation and 48 hours incubation. For Brucella militensis, there are no growth on the black agar, chocolate agar, and MKAK. And for the Orcobacterium entropy and Orcobacter intermedia, you can see growth seen on the BA, CHOP, and also MKAK. And after 48 hours, for Brucella militensis, there's no growth on MKAK, but there are tiny colonies seen on the black agar, and chocolate agar. But for the Orcobacterium species, you can see there are growth. I mean, we can see growth on the black agar, chocolate agar, and MKAK. This the key. I mean, we want to differentiate Orcobacterium and also Brucella species. This Brucella species is slow growing. Usually at 24 hours, there will be no growth on black agar and chocolate agar. On 48 hours at incubation, we just can only see the tiny growth at the first streaking. Okay, so this is morphologic and phenotypic characteristic of Orcobacterium versus Brucella. As just now I mentioned that gram stain usually for Brucella is gram negative coccobacilli. Orcobacterium usually is coccobacilli to rod, and the size of the Orcobacterium rod is approximately the length of E. coli. And from the colony growth, as we can see, 24 hours, 48 to 70 hours, 10 hours for the Orcobacterium, they can grow. You can see more colonies seen on the BA and chocolate agar. And for the Brucella species, at 42 to 72 hours, we can see just a pinpoint, I mean, just tiny colonies seen. And for Orcobacterium, it grow on MKAK. And for Brucella, it doesn't grow on this MKAK agar plate. And just bear in mind that can be for the Orcobacterium can be that delayed growth of MKAK can be observed for some of the isolate. And for the black agar, for the Brucella, we can see non-mucoid, this white, translucent, convex, a colony. And for the Orcobacterium, is creamy, smooth, and mucoid, big mucoid and hemolytic. And for this phenotypic test, for Brucella is non-motile and urease positive. And for this Orcobacterium, can be variable, can be motile, and and also urease also can be variable. Okay, Orcobacterium species are found in water, soil, plants, and animal due to their low virulence. This infection, this organism can cause infection, immunocompromised, usually related to Lyme and catheter related. And isolation from the clinical specimen often represent the colonization. Okay, this is the same like I explained before. Okay, for the identification using MALDI-TOF MS, it is recommended to use alternative tube extraction that kill viable organism. We do not direct spotting of plate in the open laboratory, and to avoid the risk of exposure to living Brucella, an initial step with absolute ethanol is added prior to the protein extraction with formic acid matrix and acetonitrile. And there is a step, and then we have to perform it in a PSC, Political Safety Cabinet. And studies reported that MALDI-TOF VITEC can misidentify Brucella mellitus as Orcobacterium entropy, and also Bruker system also can give unreliable discrimination between Brucella species. And as I know that now, I mean, for the Bruker, MALDI-TOF Bruker, they have updated our database. There is a Brucella species, I mean, Brucella mellitus in the system. So far, I have never experienced to get this Brucella from the MALDI-TOF. And then all Brucella isolates should be sent to IMR for to complete identification of the species level and for lab-based surveillance. And please contact Dr. Siti, Rosli, clinical microbiologist in unit of bacteriology when you want to send the Brucella isolate. Okay, CDC has advised that all laboratory manipulate of live Brucella should be performed in a class 2 BFC, biological safety cabinet, by the time of the bacteria isolate are suspected or confirmed, and also perform in class 2 BSC plus PPE. We have to wear, I mean, personnel have to wear PPE as well. And all blood culture, while detected as positive by automated blood cultures instrument, should be processed in BSC until the possibility of Brucella is firmly excluded. And if gram stain from the blood culture shows gram-negative coccus, bacilli, or suspected of Brucella, the culture plate should be taped shut. We can use parafilm to tape our culture plates. And then these are to avoid somebody else to open the plate. So this is one of the prevention of the exposure to the isolate in the lab. And for the routine performance of antibiotic susceptibility testing is strongly discouraged, and because of it involves a hazardous to the staff and also can cause exposure for the laboratory staff. Okay, next for the serology test. So this is helpful for the diagnosis of brucellosis. In a low prevalence area, detection of acute brucellosis can be done by detecting antibody, IgG or IgM. And the standard serological test for the diagnosis include SAT, Coombs test, or ELISA. And this is, as we can see, this is stage of brucellosis. Antibody respond to untreated brucellosis. And we know when in acute infection, the blood culture will be positive. And then after that, after 1 week onwards, the IgM will rise and will be, I mean, peak at about 3 months, and will be disappear later. And then IgG also will appear after this one up to about 1 to 2 weeks, the IgG will appear and will persist. And for the acute on chronic infection, the IgG, the IgM, and they will rise. I mean, there will surge of the IgM and IgG in the case of acute on chronic brucellosis. Okay, for the serology test that offered by IMR, they are doing screening test by ELISA method. This is for detection of IgM, IgG, and the index, antibody index, if less than 9 is negative, 9 to 11 will be equivocal, and more than 11 is positive. Once we get, a sample show equivocal or positive antibody index, they will proceed with Brucella cap to confirm, and then this Brucella cap is an immunocapture agglutination for detection of total anti-Brucella antibodies, and this test to determine the total Brucella antibody, and then for the interpretation, the titers more than equal and more than 1 in 320 suggest brucellosis, and titers equal or more than 1 in 1,280 suggest chronic and relapse brucellosis. Okay, PCR is only useful for acute but not chronic brucellosis, and since bacterium is present in the acute stage of infection, and only cases with history of risk factor should be sent for PCR. A sample that can be sent for PCR, either whole blood in EDTA, CSF, or Brucella isolate. Okay, so I will talk on human brucellosis outbreak. So, what is the definition of outbreak? Outbreak is defined as more than one probable or confirmed cases of brucellosis with an epidemiological link within 60 days, and the common source epidemic or outbreak can occur as a result of ingestion of unpasteurized milk, raw milk, or dairy products, and aerosol infection can occur, such as in laboratory and also abattoir workers. Okay, we had an outbreak in Penang. This occurred from March 2011 to March 2012, and case report published by Penang GH. This was the largest outbreak of brucellosis in Penang, and due to index case of 45-year-old goat farm owner presented with 3 weeks history of fever, headache, severe lethargy, poor appetite, and sweating. And he had a history of consuming unpasteurized goat's milk and also sold the goat's milk to the public. And tests for the tropical diseases all were negative, and blood culture also showed no growth. And then for the epidemiological clues, they sent Brucella serology and turned out to be positive. And over the period of 1 year, there were 79 patients who had consumed milk from the same farm were diagnosed with brucellosis. 2 of these patients were workers on the farm. 4 laboratory staff had also contracted the disease, presumably through handling of the blood sample. And from this study, this case report, the duration from onset of symptom to diagnosis was 53 days, and maximum duration of 210 days. They were given combination treatment rifampicin and doxycycline for 6 weeks. 1/3 of the patient had sequelae after recovery, and 21% had relapse. And then they highlight the importance of brucellosis as differential diagnosis when the patient had unexplained chronic fever. Okay, so I would like to share our outbreaks in Klang district. 2 human brucellosis outbreaks occurred in Klang district from September 2018 till February 2019. We have 2 human brucellosis outbreaks. And okay, for the first outbreak, involved 4 patients had brucellosis after drinking improper pasteurized goat's milk from a single goat farm. This occurred around September 2018 to December 2018. And then the second outbreak, 4 farm workers from a cattle farm also had brucellosis. They own a cattle farm handling the cattle and feeding the cattle, and claimed they had a history of consumption of wild cow's milk. Okay, this occurred from December 2018 to February 2019. Okay, for the first outbreak, history of drinking improper pasteurized goat's milk from Farm M, situated in Klang District in 2018, and 7 cases detected from hospital admission, and 1 case detected through active case detection. 4 cases from Klang, 3 cases from Petaling, and 1 case from Sepang. And the age of the patient between 4 to 39 years old, and from the investigation, epidemiological linkage, and also lab result have been proven that all the cases and between all cases and the focus of goods with positive Brucella melanosis from Farm M. Okay, this is the an epidemiological link from Farm M. This patient MH and Y. Patient MH is the owner of the goat farm, H farm. They bought and sold goat's milk from Farm M. And this patient MN had history of drinking improper pasteurized goat's milk bought from Farm H. And this patient AF had history of drinking improper pasteurized goat's milk for the past 1 year, and the relative selling goat's milk, which was supplied from Farm M. So this is the epidemiological link, and I would like to share the clinical profile and lab diagnosis from these 4 patients. Okay, this patient MN, a 10 years old Malay boy, date of onset on 20th of September 2018, and was admitted to HTA on the 8th of October 2018. This boy presented with prolonged fever for 2 weeks, associated with headache. And on examination, he was alert, conscious, lungs clear, CBS, dual rhythm no murmur, and per abdomen soft. The throat was mildly injected with grade 2 tonsil and no exudate. And from the laboratory test result, IBC showed leukopenia and thrombocytopenia. And he initially was treated as acute tonsilloparangitis and was sent for the workup. They will send blood culture CNS to the laboratory. And the initial diagnosis was acute tonsilloparangitis, and the blood cultures that sent to the lab was positive on day 3. And then we couldn't get the identification of the blood culture, couldn't get the ID for the blood culture, and then send the isolate to IMR, and turned out to be Brucella DNA detected by PCR, and it was Brucella melanosis. And this boy was referred to PITS ID and was given the treatment of the brucellosis, given rifampicin and doxycycline. And for the patient number 2, MH, 28 years old, Malay, owner of the goat farm, and the date of the onset on the 25th of September and date of admission on the 4th of November 2018. He had history of prolonged fever for 2 months, headache, night sweat, and lethargy. And on examination, just to highlight that he had splenomegaly, and the rest with fever 37.8, and from the lab test, the FBC showed thrombocytopenia, LFT, elevated LFT, and blood culture also positive, and they are sending to IMR for the PCR, and Brucella DNA detected, and Brucella melanosis was identified. And from the ultrasound of this patient, showed splenomegaly, no intra-abdominal collection, and CT brain, no significant intracranial abnormality, because the patient also complaining of headache, and he was treated as brucellosis, given doxycycline and also rifampicin for 6 weeks duration. And patient number 3 is a boy, 5 years old, Malay boy. Date of onset on the 4th of November 2018, and he was admitted twice on the 7th and the 15th. Okay, initial admission was treated as pneumonia, and that time he was admitted for the pneumonia and was sent blood culture on the first admission, and blood culture turned out to be positive Brucella, and patient they have to recall patient, and patient re-admit. And for the admission, he had fever for five days, cough, runny nose, headache, lethargy, vomiting. And from the examination, patient alert conscious, but this patient had, from the CNS examination showed wrist reflex of both lower limb, and for the pediatric, they suspected of this Neurobucellosis, and for the blood culture is positive for the Brucella DNA detected by PCR, and they did LP for this patient, CNS no growth, and CSF PCR showed, report us out as a Brucella militancies detected. And this boy was treated as Neurobucellosis and was referred to PITS ID and given parenteral ceftriaxone gentamicin as well as Bactrim and rifampicin. And the number 4, the patient NH is the MH wife. Date of onset was on December 2018 and was admitted on the 15th of February 2019. She had prolonged fever for 2 months, intermittent fever, and she presented with rashes for 1 week, started from bilateral distal to proximal lower limb, easy breathing, loss, and also loss of appetite. And from examination, PA per abdomen was soft, but liver edge palpable. The rest bilateral lower limb petechia and non-blanching. Otherwise, patient alert conscious with afebrile. And laboratory results showed FBC. FBC results showed pancytopenia, and the FBP, blood film, FBP, and showed a mild neutropenia with thrombocytopenia, iron deficiency anemia, and blood culture also Brucella detected, DNA detected by PCR, which was Brucella melanosis, and Brucella serology was sent IgM, IgG positive with Brucella cap more than 1 in 5,120. And she was given IV rosafim for 2 weeks and was treated with doxycycline and rifampicin for 6 weeks. For 6 weeks. All of the patients were discharged well and follow up at the PITS ID and as well as ID clinic. Okay, I would like to share a poster from Dr. Farida Husmin from our Klang Health District. She shared her poster on this outbreak. What are the findings from this outbreak? There was delay in identifying human outbreak because cases from different districts, because 4 cases from Klang and cases from Sepang and other district. And there is livestock without veterinary examination, unknown status, no isolation system between healthy and sick livestock, unknown status, no PPE while handling animals, improper method of pasteurization, and the owner unable to prove how they pasteurize the milk. Livestock products sold without labels, and no surveillance system of animal with illness or having abortion, no monitoring or surveillance system of workers' health status, and products were advertised and sold through social media, Facebook, Instagram without control, including raw milk. Fragmented intervention measure for control and prevention by stakeholders, and a big loss and huge economic impact to the owner because of culling, disposal, and penalty the owner. And then
Roshalina, do you still have a lot of slide?
yeah.
Do you still have a lot of slides? How many slides left?
Oh, how many? Sorry.
How many slides?
How many
More
slides? Another, I think, of 3 or 4.
Can you do it within like 2
Okay.
to 3 minutes?
Okay, right. So discussion and then for the main issues from this outbreak, there are no license needed to start a farm, and the recommendation to get farm licensing notification and compulsory registration to veterinary and health department as point of entry, inventory to all of all farm and dairy processing premises, no compulsory, and the other issue is no compulsory training, pre-exercise training under food hygiene regulation 2016 for food handlers, pasteurization and labeling. No real-time data sharing from veterinary department. So the recommendation to recommend real-time sharing of surveillance data of positive brucellosis. And this brucellosis is non-notifiable disease under CDC Act. So should include brucellosis as a notifiable disease. And currently brucellosis is administrative level, and loose lack of monitoring online marketing sale, and so compulsory registration training and licensing include home-based milk processing facilities, and a communication gap because of this regular zoonosis must have this committee meeting at all level involvement of all stakeholders. Okay, we have the second outbreak case related to a cattle farm. This patient owned a cattle farm, and whole family work at a cattle farm. They are cleaning the farm and feeding the cattle, and his claim had history of drinking boiled cow's milk. I just got the summary of 3 patients. Okay, patient M is owner of the cattle farm, 48 years old Indian man. Date of onset on the 1st of December 2018 and admitted on the 16th of December. He presented with fever for 2 weeks with headache and myalgia arthralgia. And on examination, he had hepatomegaly, and lab result FBC showed normal, and LFT elevated ALP and ALT, and blood CNS Brucella detected by PCR. And from the management wise, he was treated with doxy and rifampicin, and ultrasound scan was done for him, just fatty liver, no hepatomegaly. And okay, for the second patient is the patient Y. Date of onset on January 29 and admission to the ward on the 18th of February 2019. His wife presented with right-sided headache for 1 month with joint pain, poor oral intake. On examination, CNS was normal, and from the lab result, FBC, LFT was normal, blood culture no growth, CSF LP was done for this patient, CSF, CNS no growth, and CSF PCR also no Brucella detected, but Brucella serology turned out to be positive. And for the CT scan brain, for this patient, no ICB hydrocephalus, and she was treated as neurobrucellosis. So for the neurobrucellosis, I was given IV rocephin for 2 weeks and was treated with doxycycline and rifampicin. And third patient is patient son, and presented with date of onset on January 29, date of admission on 19th of February, after 1 day after his mom. And he presented with prolonged fever for 2 months, flu-like symptoms. On examination, all the system normal. Lab result FBC, LFT normal, blood CNS no growth, and Brucella serology negative, and he was treated as a probable case. Treated with doxycycline rifampicin because of he's still having fever and still symptomatic. Okay, for the outbreak management, I think this district health office should investigate all clinical probable and confirmed. For notification purposes, only probable and confirmed are notified within 1 week. Or symptomatic should be assessed by physician, ID physician, or ID for treatment. And to identify the common vehicle of infection, if the source is found to be product, to stop production, distribution, sale, and recall the incriminated food product immediately. Public should be advised not to consume the food product. Instead, it should be discarded. And like sample should be taken, and for the clinical sample from symptomatic and also food sample suspected to be the cause of the outbreak. My conclusion, brucellosis is public health concern even in low epidemicity countries, and under detection may lead to substantial disability and outbreak occurrence. To get further history on risk factor of brucellosis is prudent for all patients presenting with fever of unknown origin, because it will lead to early diagnosis, treatment, as well as to minimize risk of laboratory staff exposure. And as outbreak of human brucellosis, animal brucellosis are interrelated, and integrated approach between all relevant agencies in outbreak management is crucial. Thank you.
Right, thank you, Dr. Roshalina. Okay. We have spent nearly almost near 2 hours listening to very informative, substantive, excellent presentation from both of our speakers. So there's a few questions, mostly most from anonymous, and Prof have helped us to answer most of the question. Prof?
Yes, I already answer. I hope I help them. I hope I hope they get the answer. Yeah, they what to say, happy with the answer. If not, maybe they can email me.
Yeah.
Then I
This is
can.
the one
Yeah.
that is still typing, Prof. Are you going to finish the typing, or are you going to? Can you answer live?
I already answer all, I think.
Right. Okay.
Ah, ah. And
So
I attach one protocol for from DVS. This is for eradication program. Yeah.
right. Can
Yeah. Ah.
Alright. Okay. So Dr. Roshalina, there's one question. For human brucellosis, why Brucella serology need to confirm with Brucella caps? Can you help to answer this, Doctor?
Okay. For this Brucella, okay, that been for the ELISA is just a screening test. So it's a screening test. We just screen whether this is IgM, whether IgM or IgG positive. One, it is turn out to be equivocal, and equivocal or positive, we have to confirm. We have to have this specific test. Is we call it Brucella cap, to confirm it is Brucella infection. So Brucella cap is an immunoagglutination. I forgot the name. This test is to confirm Brucella infection.
Can the serology test Brucella caps? Can determine either it's a recent or infection or latent infection?
For IgM is IgM is acute for the for okay. But just now doctor asked about this for Brucella cap, they will show the title for this more than 312 is brucellosis. If chronic, the title will be higher, more than 5120, if I'm not mistaken. So
All right, thank you, Doctor. There's a request from our participants for the host to share the video and the slide.
sorry, Dr. Mimi, sorry. Just now title more than 1 in 1,280 suggest chronic and relapse brucellosis. 1 in 1, title 1 in 1,280.
1,000.
1,280.
What's for
Sorry,
relapse?
sorry for the wrong information just now. I mentioned about 5,000.
Okay. So my can I ask the Prof? Last question.
Yeah, Dr. Mimi, yeah.
Yeah, you mentioned about the eradication program.
Mm-mm.
How the animal is selected to be tested for Brucellosis species, or is it a routine program, or is it just only when they suspect that the outbreak is occurred?
Oh, for animals, I mean for livestock, cattle, sheep and goat, they have a program. That means a scheduled program. They go, I mean the group of, I mean they have like for DVS, they have a group. So they collect the sample twice a year. That means they have a program. They already a scheduled program. And just now I just share the protocol for animal brucellosis in our
Chat
chat.
box.
That
Chat
means,
box. Is
yeah,
it the PVM Brucellosis?
yes.
Okay, right.
That one is complete. Yes.
Okay. Okay. Thank you, everyone. So, yeah, we nearly finished. Last, if possible, can I have Puan Hartini to explain because I'm not a part of the member, but I want to know how to be a member of this MSIDC Zoonotic Interest Group. Can any of the hosts help to clarify this one?
Hello, Assalamualaikum. Sorry everyone, online
Wow.
from the road bank. Uh,
Green.
Feel free to join us. We will share the link for registration through your email that you register for your attendance. And from there, we will invite you to a dedicated closed WhatsApp group. And from there, we can share information, and you might be the next moderator and the next speakers of our next zoonosis topic. Thank you. Thank you, Dr. Mimi.
Thank you, Dr. Ridwan. Okay, with that, we shall finish our CME for today. See you all again in the next CME session. Thank you, everyone.
Thank you.
Thank you, Dr. Mimi. Thank you, Dr. Roshalina. And thank you, Prof. Khairani. And see you next time. Assalamualaikum. And good evening.
Allah.